In South Africa, many women and men face complex health burdens. Chronic conditions and multiple risk behaviors are prevalent, even among the young. This is particularly concerning for women, as data from Soweto reveals. 43% of young women aged 18 to 25 years are unemployed, and 28% experience food insecurity. Additionally, 22% are anemic, 15% will be living with obesity, are hypertensive, and suffer from probable depression. Many have experienced unresolved trauma and adverse childhood experiences. Recognizing the critical importance of physical and mental health for women, we launched the Bukhali study to see if an 18-month community health worker-focused intervention could improve their well-being. For those women who became pregnant, we initiated a continuum of care package from preconception to post-delivery to determine if we could improve both pregnancy and child outcomes. Bukhali is part of the Healthy Life Trajectories Initiative, with similar studies ongoing in Canada, China, and India. Every human being starts out as a single cell and develops into a complete person. From the science of developmental origins of health and disease, we know that as a baby develops during pregnancy, it is shaped by mom's and dad's health and the environment in which he or she grows, and this influences the baby's lifetime health. However, most women do not present to their healthcare provider until the second trimester or even mid-pregnancy, so opportunities for interventions during pregnancy are limited. Every woman and man should be thinking about their own physical and mental health, whether or not they are planning a pregnancy. This is particularly crucial considering about 70% of all pregnancies in South Africa are unintended. Unplanned pregnancies are at greater risk of preterm birth and low birth weight babies.
I actually didn't know what preconception was before I did the Bukhali study. People are just wrapped around this modern fast life that we have, and they actually don't take time to focus on their health.
If ever you're not healthy yourself, it might also affect your unborn baby.
If we're going to talk about HIV and pregnancy, then might as well talk about preconception health as well.
I found out that I have anemia through the study of Bukhali, and I understood the term that it's a lack of iron. So my partner and I are eating healthier. We now exercise so that when the time comes for us to conceive, we are both ready mentally, physically, and emotionally.
At the heart of Bukhali is the community health worker who is delivering the intervention.
So my role as a community health worker is to not only provide information, but as well as support young women in Soweto, helping them change their daily lifestyle to live a better life, so that in the long run they don't end up developing what we call non-communicable diseases.
When we started the study, I think we never understood how powerful these community health workers will be. They create a bridge between an underserved community and the healthcare service. They come with solution on a practical level because they go into this community, and most of the time they are from this community. So they understand the problem, they understand language, they can simplify the information, they can support and walk the journey with the patient.
When I joined the study, my facilitator, Kile, actually encouraged me that I really need to take care of my health, start exercising. I decided that I need to go back to gym and I need to start eating right. And from then to now, I've just been consistent with taking care of my health.
In Bukhali, we use the healthy conversation skills philosophy. This philosophy helps young women to actually come up with their own changes, so that these changes, they are for them and they own them, and they don't come from the health helper, so that the goals that they want to achieve is something that they strive for, not something that they are given by someone. Sometimes with them sitting together, it creates an atmosphere of them being understood by others, and then through that, they create connections that they actually take into the community.
I was not able to speak about my problems or my home situation with other people. But since I've been in the study, from the first day I spoke about my situation. It has helped me a lot because now we learn about different things. It's like we're at school and I'm getting some experience. Because if there was no lessons received from Bukhali, maybe I would have killed myself.
When I got to come to Bukhali, I got to see a much more broad perspective on preconception health. It's advocating for women, and not just women only, but men as well.
I received a call from Bukhali study. Before receiving a call, I didn't know anything about preconception, and I never thought it's very much important to know about your health before you can have a baby or before you can plan having a baby.
We are seeing a lot of change where these young women are actually starting to make decisions for themselves, doing what's best for them and their babies or their lives, their health going forward.
I'm very grateful to this study because I was not going to be able to prepare for my future baby.
Discipline and consistency goes a long way.
My goal is also to encourage young boys to take care for themselves.
If we are thinking of future generations, we have to invest in the community health worker. They are capable of changing how the message is delivered in the community, where the community is going to be attracted in actually applying preconception health.
So I think government should provide programs in order to know how to care for yourself.
Healthcare facilities should be able to go out into schools, parks, community halls, and even just people's homes to actually educate people about preconception and the importance of people actually taking care of their health.
Health burdens in countries like South Africa are increasingly complex. We must pivot towards preventative measures and initiatives that enhance the well-being of both women and men. This isn't just for their benefit, but also for the future health of their children, should they choose to conceive. By prioritizing community health worker-based prevention initiatives and improving health of youth, we can disrupt intergenerational disease transmission and pave the way for a healthier future into late adulthood.